Assalamu alaikum warahmatullah. Dear student, this is our second lecture in clinical nutrition, and we will talk about the body composition and the nutritional assessment. So, body composition is the proportion of muscle, bone, fat, and other tissue that make up a person's total body weight. Body composition generally refers to the absolute amount of fat and non-fat tissue within the body. So it simply can be divided into fat mass and fat-free mass. The other method is to divide it into fat mass, mineral and protein, and total body water. Okay? So normally, male person, they have between 22 to 25% of their body composition as fat, while female 28 to 32%. More than this is abnormal, and less than this is also abnormal for our health. So why we study the body composition? Because sometimes from outside you think that people they have similar weight or similar build. They may have a similar body composition, but this is not true. For example, if we look to the right side here, we have lean body mass 75% and fat mass 25%, while on the other side, it is less fat and more lean body mass. Lean body mass mean the muscle mass or the protein part of the body composition. This is another example. If we look to these two persons, they have the same body weight, but their composition of fat is different. So how we can measure how much fat in our body? And so this is uh, the target of our lecture today, how to measure the body composition as much as possible, uh, as accurate as possible. So the body composition is important because this fat inside our body may affect our health in different way. For example, this fat in the central obesity, and this may release inflammatory markers and increase the toxin level inside our body, and this may cause global inflammation in our body. Additionally, this fat may infiltrate muscle, and this may cause a condition called sarcopenic obesity. Sarcopenic, which means that there is deficiency in the muscle here in relative to the fat. So from the outside, if you look to these two arms, they have similar circumference. From the outside, they may seem as there are no difference between them. But if you look from inside, here there is more muscle mass and here less muscle mass. So how we do a nutritional assessment? We do nutritional assessment by taking a detailed medical history, physical examination, anthropometry, laboratory investigation, and dietary assessment. So it is the same as usual in a clinical practice, except these two measurement, which is the anthropometry and the dietary assessment, and we will talk about them later on today. Medical history. Weight history, the most important part of nutritional assessment is to take information from the patient about their current weight and their previous weight, and then we can compare. If there is more than 10% of body weight change over 3 to 6 months, this is significant and may indicate a serious illness, like, for example, cancer, tuberculosis, leukemia. All these serious disease can lead to serious reduction in the body weight. Medical and surgical history. Many medical and surgical conditions are known to impact inflammatory and nutritional status and are often associated with characteristic malnutrition syndromes. For example, if the patient have intestinal resection, and this may cause malabsorption, or if the patient have inflammatory bowel disease, and this also may lead to malabsorption. celiac disease. They all may cause a nutritional deficiency. Okay, and medication history is important because there are some food drug interaction. Drugs may lead to malabsorption of food. For example, certain lipid lowering agent, cholestyramine, may lead to malabsorption of fat soluble vitamins. The drug orlistat, which is used for weight reduction, also can cause uh, vitamin deficiency. On the other side, also food may affect the absorption of drugs. For example, taking certain uh, supplement that contain minerals may lead to reduction in the absorption of drugs like tetracycline. Physical examination. The physical examination is important for a nutritional assessment. We start by looking to the highly turnover tissues like this, the hair, the skin, the mucosa, the oral mucosa, the conjunctiva. For example, if you look to this hair, these different color, they call it flag sign, which indicate a protein deficiency. And also here, if you, this is a type of hair which is commonly seen in patients with malnutrition and vitamin deficiency, easily plucked, easily plucked hair. Okay, and then we look to the eyes, and here we look to the conjunctiva. This is a normal conjunctiva, and if you can see that this is the redness is normal, and while looking at here, there is anemia because it is pale, and this is may indicate anemia. Here, this is one of the physical signs of iodine deficiency, which is goiter and hypothyroidism. Now, if you looked at this tongue, this is normal tongue, while this one is smooth, pale, which may indicate vitamin deficiency or iron deficiency, and they call it glossitis. Here, chylosis, also an inflammation of the angles of the mouth and may indicate vitamin deficiency. If you look to these two hands, you can see that there is a little bit difference in the color, and this is more orange in color, which may indicate beta carotene excess. Those who eat a lot of carotene containing food like carrots or green vegetables, they will end it in discoloration in their skin. Now, if we look to the hands of a patient with the iron deficiency anemia, we may see the koilonychia, which is spoon-shaped nails. Spoon-shaped nails indicate iron deficiency anemia. And if we look to the legs of the patient, we may see edema, edema as you can see here by physical examination, and this may indicate a thiamine deficiency or the edema of beriberi. Beriberi is a vitamin deficiency, and we will talk about it in the next few lectures. Anthropometry. So this is the anthropometry is to measure the height and the weight of a patient, and this is very important to estimate the body mass index, which is an index of body composition. If the patient cannot stand up, like he is bedridden and he has some problems, so we can measure the knee height caliber. So the knee height caliber, and then we enter this knee height caliber into a certain formula, and we can estimate the stature or the length of that patient, and then we can use it to calculate the body mass index of that patient. The other important measure also in body composition and the nutritional assessment is the skin fold thickness using certain calibers that um, uh, used usually in your nutrition clinics, and that can estimate how much fat in the subcutaneous tissue. And this is also indirect measure about how much the distribution of body fat in relation to the protein in our body. So as you can see, the body fat percentage, there is some essential fat in male and female, and this is very important to have certain level of fat in our body. Otherwise, there will be derangement in the physiological function. While more than 31 in female or 25 in male, this is may indicate obesity. The other also body composition or anthropometric measurement is the mid-arm circumference, which is between the trochanteric and the greater trochanter and the clavicle, the midway between them, and then we use the tape measure to measure the circumference in the mid-arm. With the skin fold thickness, we can have an idea about the body composition of the patient. The waist circumference also is very important. The most important role of the waist circumference is to give us an idea about the central obesity, which is one of the major issues that lead to cardiometabolic diseases like cardiovascular disease, diabetes, metabolic syndrome, and etc. So how we usually measure the waist circumference is the midway between the lower ribs and the iliac crest. Maybe we can measure the waist circumference here. And then the hip ratio at the widest area in the body. Also, we can measure the circumference. And then we have the ratio, the waist to hip ratio, also an indicator of body composition and central obesity. As you can see, this is, they call it android shape, and this is the gynecoid shape. It is apple shape, and this is pear shaped. A ratio above zero point 0.8 in women and zero point 0.9 in men is taken as a measure of abdominal obesity. An increased value indicate higher level of cardiometabolic risk. And lastly, we will talk about the dietary assessment, how we assess the diet of a patient by many methods. One of them is the food diary or record charts. We ask the patient to take this chart with him, and for 3 days he record everything he eat in all these days and bring it back to us. And then we can estimate how much calories and what is the composition of his food and whether it is healthy or unhealthy, whether it is sufficient or insufficient in nutrient. We can enter this information, or the patient can go directly to this website, and this is in the US. They can enter this website and they enter all the food they have eaten over a 24-hour, and then they can give them an estimate of how much calories, how much nutrient in their food, how much protein, how much carbohydrate, and how much fat, and also give them advice whether their diet is healthy or unhealthy. Lastly, there is another method to estimate nutritional intake is the food frequency questionnaire, and usually this used in research only because it is a very elaborative, comprehensive information that need maybe more than 1 hour to be filled by the patient, and it contains around 30 pages of all this information regarding the diet of the patient over the last month, and it can give an estimate about the nutritional component and how much calories and what is the uh, major component of the diet of the patient in protein, in carbohydrate and fat, and how much vitamins and minerals. I hope you find this lecture simple for you. Thank you very much for your listening, and see you in future lectures. Thank you very much.